Hi, it's Patrick Hutzel from intensivcarehotline.com with another quick tip for families in intensive care. Today I have an email from Sylvia who says, "Hi Patrick, my brother recently had a massive accident in Tennessee on the 3rd of July. He went into the trauma hospital followed by cardiac arrest, which led to a loss of oxygen supply to his brain. And his EEG, MRI, and CT scan of the brain show no signs of major injury, but it's been 14 days since my brother hasn't responded. He's currently in ICU. The doctors believe there must be an anoxic brain injury. I'm terrified, though. We all live in India and can't get there. It's been a very difficult situation. I really have hope he will respond, but would take some time for recovery. Can you please share your insights?" Thank you, Sylvia, for sharing your brother's situation. Well, it all comes down to what the MRI and the CT scan show of his brain. If there's no injury, then there's no injury. Then he will just need time to wake up. A lot of patients in intensive care without a brain injury that have been in an induced coma take their time to wake up. It might take days, sometimes weeks to wake up, even without a brain injury. It also depends on what sedatives and opiates he's on. Are they long-acting? Are they short-acting? Propofol is short-acting. Midazolam Versed is long-acting. Is he getting a lot of opiates that will also temper him when waking up, right? Has he been paralyzed, like with medications that will also delay him waking up? Also, when someone is critically ill, waking up takes time. It doesn't happen in a heartbeat. Waking up after an induced coma is like switching on a light with a dimmer, not like switching on a light with a switch. It can take time. When someone is critically ill, their body just shuts down and they simply need time to recover. It's such a major insult to the body that you just simply need to give your brother time. With much good medical and nursing care, hopefully he will come out of that. You shouldn't give up. It's only been 14 days, which also is not a long time. 14 days in ICU is not a long time. Okay, so you got to be patient. And I know what sounds like an eternity to you is just not a long time here, right? It also would help if you give us access to the medical records, or if we can talk to the doctors and nurses directly, because we will ask all the questions that you haven't even considered asking. And in conversation with the doctors and nurses, we also often get more information, get different information that you haven't simply been able to extract from them, because, you know, after having worked in intensive care for nearly 25 years in 3 different countries, where I also worked as a nurse manager for over 5 years, you know, and I know what I'm looking for, I know what I've been asked, what I'm asking, you know. I've looked after thousands of critically ill patients and their families in intensive care, and I've been consulting and advocating for families in intensive care since 2013 here at intensivcarehotline.com. And you can look up our testimonials on our testimonials section. You can also look up our podcast on our podcast section with client interviews, what they say. We have undoubtedly saved many lives with our consulting and advocacy. And that's also why we created a membership for families of critically ill patients in intensive care that you can become a member of when you go to intensivcarehotline.com. If you click on the membership link, or if you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in the membership area and via email, and we answer all questions intensive care related. In the membership, you also have access to exclusive content such as 21 ebooks and 21 videos that I have personally written and recorded for you, for our members, so that you can make informed decisions, have peace of mind, control, power, and influence when your loved one is in intensive care, making sure your loved one gets best care and treatment. I also offer one-on-one consulting and advocacy over the phone, Skype, Zoom, WhatsApp, whichever medium works best for you. I talk to you and your nurses and your families directly, and I also talk to doctors and nurses directly. Once again, I ask all the questions to the doctors and nurses that you haven't even considered asking from all my experience, making sure that you make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment. And you will see that the dynamics will change in your favor once you get an advocate involved. I also represent you in family meetings with intensive care teams. We also offer medical record reviews in real time so that you can get a second opinion in real time. We also offer medical record reviews after intensive care if you have unanswered questions, if you need closure. or if you are suspecting medical negligence. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website or send us an email to support@intensivecarehotline.com with your questions. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, comment below what you want to see next, what questions and insights you have. Share the video with your friends and families. I also do a weekly YouTube live where I answer your questions live on a show, and you get notification for the show once you subscribe to my YouTube channel. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.